Okay, everybody. We're back. I had to this is on a second recording because I actually had to take a break for a little while for something, and I didn't want to leave it on pause for too long. I was not sure how that's going to work out. So instead I just recorded a second recording here. As I was taking the break though, as I was on this little break here doing something, I realized that there's the point I was trying to make about uh, the the differences in how the clinical skills are worded and named on the MNPI 3 compared to the MNPI 2. It's interesting that there's a parallel, but it's different. And there was one that was the most obvious. I kind of skipped over on the MMPI 2. Um, the fourth scale is called psychopathic deviant. Measures alienation, social disinhibition, the tendency to come into conflict with family, authorities, and others through rebellion, exploitation, misconduct, poorly developed conscience, and the lack of internalized moral standards. Now, notice how the parallel to that, or the closest parallel to that on the MMPI 3, is specifically called just antisocial behavior. So there's a real separation out of the symptom, the specifically behavior, and not really the diagnostic um, expectation or the diagnostic category that it would fall under. So really with the DSM, I'm sorry, the DSM, with the MMPI 3, the focus really is on describing symptomology as opposed to diagnoses. Um, you know, antisocial behavior as opposed to psychopathic deviant. Psychopathic deviant, of course, not being a diagnosis, but it's more of a construct, and the behavior is more specific um, symptom. So that's one of the differences with the MMPI 3. And just to talk about some of the other subscales. Um, Stress and worry are two different. Some interesting conceptual things about the MMPI 3. There is a stress subscale and a worry subscale. Um, Stress is problems related to nervousness, so feeling nervous, and worry is basically preoccupation. So stress is maybe more the physiological symptoms of anxiety, and worry is more of the cognitive. Um, and then there's one anxiety related to experiences, which measures sort of the ability to or the tendency to catastrophize, um, which can be a very significant, considerable problem in anxiety. Um, And then what's interesting is there is a um, sort of a theoretical construct of personality called the five uh, levels of personality. And those are actually in here. There's aggressiveness, psychoticism, disconstraint, negative emotionality, and introversion. Aggressiveness is uh, tendency towards uh, aggression directed in a certain direction. Psychoticism is disconnection from reality. Disconstraint, under controlled behavior. Negative emotionality is anxiety, insecurity, worry, and fear. And introversion is social engagement. So there's really, I mean, the MMPI 3 is what, but there really does seem to be an attempt to sort of break it down than maybe the MMPI 2 did into specific areas so as to really gain a picture of the person's personality. You have to wonder if maybe they might be breaking it down into too many different levels. But that's what they're trying to do. So, you can pull up MMPI 3 on online, and you know, you'll probably be able to find something that tells you what you can look at all the different scales. But like I said, I just wanted to tell you a little bit about how the instrument is going to work and what it's going to look like. Um, and in fact, just to tell you a little bit more about the MMPI 3, um, there are, and one of the reasons I couldn't go through all the scales is there are 52 total scales, and they are broken down into eight different categories. There's the validity scales that I already talked about, and the restructured clinical scales. There are two. One is well, there. Then there's the personality. I talked about the personality uh, scales, the five personality scales of psychopathology. Um, I already talked about that. Aggressiveness, psychoticism, uh, disconstraint, negative emotionality, and introversion. And that is, I think I should say a little bit more about that. That is a theory of psychopathology that rather than base diagnoses on specific symptomology, there's a theory that um, assessing psychopathology is better done through looking at the person's functioning in five different areas, those five different areas. Other categories that the scales fall under: higher order um, has to do with uh, uh, the sort of the ordering of the person's symptomology, whether they are emotional, cognitive, or behavioral. Specific problem scales um, that has to do specifically with physical and cognitive complaints. Internalizing scale, more there's a set of internalizing scales and a set of externalizing scales. Internal has to do with internal problems like worry, stress, helplessness, suicidality. Externalizing scales are um, external to the person, more like behavioral or environmental problems, family conflicts, substance abuse, impulsivity. Interpersonal scales are the other ones. Those have to do with how the person tends to look at social relationships. And you know what? Uh, these these um, these five traits of psychopathology I talked about, the PSLI 5 is what they're called. I did realize there was one other things I wanted to say about that. They are actually listed at the end of DSM 5. Um, it's an interesting thing to keep in mind. And this will be something that's kind of noteworthy about the DSM 5. I mean, about the MMPI 3, and will be interesting to look at. Um, there was under DSM 4 personality disorders, which are considered to be these lasting aspects of a personality that is problematic, that is pathological. Under DSM 4, personality disorders were a separate category. There were five axes, and personality disorder was axis two. That changed with the DSM-5. So personality disorders were listed with the other diagnoses. But there still was this thinking that personality disorders are different. Personality disorders are more a pathological um, dynamic to how the person's whole personality works. And so if you get DSM-5 and you look at the back, there is an alternative model of personality disorder, sort of this thinking that there should be a different way to view personality. And in DSM-5, it's listed as these 5 traits: negative affectivity, detachment, well, no, not exactly the same. The words under DSM-5 are negative affectivity, detachment, antagonism, disinhibition, and psychoticism. These 5 traits listed on the MMPI-3 are seen as connected to that trait model in the DSM-5. It is not formally part of the DSM-5 diagnostic process. It is listed in the back as an alternative view to how to view personality disorders. Now, where I want to finish today, and I think this is very interesting, is an article from uh, a publication called the National Psychologist, which is it's associated with a large psychology group, sort of like the American Psychological Association, but not as large. But the National Psychologist, is pretty prominent um, periodical for psychologists and talking about what's going on in the field of psychology. And I wanted to read from you. Um, the article is dated April 13th, 2021, and the name of the article is FAA will skip latest version of MMPI. So this is basically the story about how the Federal Aviation Administration will continue to use the MMPI 2 to evaluate pilots and other aerospace personnel. And I wanted to read you uh, what they say about the MMPI 3. Is that it is a completely new test and not a revision of the MMPI or the MMPI 2. And you could see that's a quote. And you could see the argument, um, how that's being made. Actually, what they're referring to here as well is in between the MMPI 2 and the MMPI 3 was a test called the MMPI 2 RF, which I talked about earlier, and that was very similar to the MMPI 3, but it was seen as an alternative, not a replacement. There wasn't even questions. Most everybody was still using the MMPI2, but there was this MMPI2 RF. In fact, when I sent in my uh, when I would send in my test results to get them back, I wouldn't even have to say don't do the MMPI2 RF. They would just automatically do the MMPI2. But the MMPI2 RF was seen as a, a new was very similar to the MMPI3, and there was no question at the time that the MMPI2 RF was not a replacement for the MMPI2. It was an alternative version. It was a completely different it was a completely different test. That's what the FAA argument is that what the MMPI3 did was build on the MMPI RF, and the MMPI RF was an alternative to the MMPI2, but it wasn't a replacement. It wasn't a new version of the MMPI. It was a different type of test. Um, Similar to, you could make the argument that the MMPI-A, the one for adolescents, is not a replacement of the MMPI-2. The MMPI-A is a different test. It's a test for adolescents, and with the MMPI-A, it is an alternative for individuals 17 to 18-year-olds because um, you can start giving the MMPI-2 at age 17 and you can give the MMPIA up to 18. So there's this overlap of 17 to 18 where you could give them either one. Um, so it's almost more similar to that the MMPIA is an alternative for 17 to 18-year-olds than the MMPI2. So basically, again, repeating what the FAA said about the MMPI, it is a completely new test and not a revision of the MMPI or the MMPI2. So that's the argument that the FAA is making against relying on the MMPI 3. It's just a completely different test. Um, so there you go. We'll finish there for now, and I'll see you all on Thursday.